Well, thank you for joining me today for this important discussion of the report that we've been waiting for. And I want to recognize Paul Vincent, who's sitting down over here. I met with Paul yesterday, and we reviewed the findings and recommendations that came out of his multi-month review of the Division of Child and Family Services at the Department of Human Services here in Arkansas. And if you go back, I called in Paul Vincent to conduct this independent review under the auspices of the Governor's office to make sure that we're doing all that we should as a state in terms of protecting our children, making progress in terms of foster care. And Paul Vincent received that mandate. He conducted over 200 interviews of both stakeholders as well as caseworkers, as well as people in the field, headquarters, looking at this, a very comprehensive review, in addition to simply reviewing all of the policies and what has happened at DHS. And I want to compliment John Selig, the director of DHS, for his support of this review, as well as the progress that has been made. And if you look at the report that's been released, first of all, Paul, I think, has given a balanced review of DHS and its performance, finding many different positives in the progress that's been made, but also seeing areas of challenge that we've been aware of that we need to address, and then making very specific recommendations. So I want to review just for a second the substance of the report, then I want to go through the recommendations and make a couple of announcements in that regard. First of all, in terms of some of the positives that struck me, DHS has been a leader for Arkansas in reducing the use of antipsychotics drugs for those children in foster care and in DHS custody or supervision. The 86% has been a reduction in the use of antipsychotic drugs by DHS, and if those in foster care, antipsychotic drugs use has been reduced by 90%. This has been a national challenge, and Arkansas has been a leader in the reduction in the reliance upon antipsychotic drugs. In addition, we've increased the adoption rate for those in foster care. The number of adoptions have increased, and the average time to adopt has decreased. That's progress on behalf of DHS, and that reflects some of the partnership that already exists in terms of adoption with the private sector, the faith-based organizations such as the Call, that has been very helpful in reducing the time period for adoptions and increasing the adoption rate. There's a number of different success stories that you could go through that's recited in Paul Vincent's report. But what's important is that we not focus on the progress that's been made, even though that's important to recognize the extraordinary work of those at DHS, the Division of Child and Family Services. They've worked hard, they've made progress, and that needs to be acknowledged. But when we look at the challenges ahead, there's 11 specific recommendations, and many of them center around the challenge in foster care. And I think in round numbers, we have about 2,800 available foster care beds, but the demand is about 4,000. And so our demand for foster care beds exceed the availability. I want to go through the recommendations, but first let me just say in general, Mr. Vincent, I accept the recommendations that have been made, and as governor, we're going to work to achieve those recommendations. I think they're balanced. I think when you look at them, about 9 of the recommendations deal with policy, coordination, things that we can address under leadership of John Selig, but then others are going to demand a greater investment of resources. And while we don't know the exact dollar number on some of the items, I've tried to put a pencil to the number of additional caseworkers that are needed, and I'm going to work with the legislature to make sure that those needs are met and that we can even make progress and win on the recommendation that's been made in that regard. The first recommendation that is made by Mr. Vincent in his report is to appoint a coordinator from the governor's office to guide and manage coordination of Division of Child and Family Services with the administrative office of the court, law enforcement, judges, behavioral health, Medicaid, and the legislature. To have, there's many agencies involved, there is interaction with different branches of government, and there's been conflicts that has developed. The recommendation is that this coordination be led out of the governor's office, and so today I'm appointing Betty Gooman of the governor's office, who has a background in this field, who's had a background in tough responsibilities from Homeland Security to Congress to the DEA, to take on this coordination role. And the responsibility is to coordinate not just what happens at DHS in Arkansas, but how it is coordinated with the administrative office of courts, work with the legislature on this, and to make sure the recommendations that have been made are met, and that we have the interagency cooperation as well as the stakeholder guidance and leadership to make sure that we succeed in protecting our children. This is not a permanent position in government. This is hopefully a less than a one-year assignment that will help accomplish and coordinate the objectives of these recommendations. The second recommendation is to increase stakeholder partnership. And today I'm directing Director John Selig to establish an independent stakeholder panel to participate in and shape the implementation of the recommendations of the report. We already have stakeholder engagement, but it's important that we have this additional stakeholder role that will play in reviewing the recommendations, helping guide the implementation of the recommendations, and to work with Ms. Gooman as she helps to accomplish that from the governor's office. The third recommendation is to address the placement challenge. I've already mentioned the placement challenge that exists, but you can put it in additional terms to think about. In the last 4 months, 22 children that were in need of protective services spent the night at the local office of DHS waiting for placement because there was no foster home that was able to accept the child. That is an unreasonable burden on our children, an unreasonable burden on our caseworkers as well. Whenever you look at the fact that there's been an increase in the need for placement over the last 2 months, from 3,800 in need of placement to over 4,300. And so that illustrates the challenge that we face. There's 55% of our placements for protective services, the placement occurs outside the county in which the child resided. That puts an additional burden on the caseworker in transportation. It puts an additional strain on family support, intervention, assistance. That has to be addressed. And so we're going to address this recommendation by changing policy and practices that restricts even the use of relative caregivers. And then secondly, we're going to have a greater utilization of our private partners. And this illustrates the importance of our faith-based summit that has been set in August, that has been announced. Our faith-based partners has helped us to address the challenge of adoption. We're now asking them to help us to address the challenge of placement of those in need of protective services and foster care, and to find additional partners that can join with us to make sure our children are not spending the night in a DHS office. One of the suggestions was to resume the licensing of respite homes. That is an additional help for our caregivers so that our foster parents have some additional help, particularly with difficult placements. The fourth recommendation is to allow greater flexibility for local DCFS staff. We have historically at DHS tried to have strict rules, uniform policies, and that reduced the amount of flexibility of our local offices. Mr. Vincent's recommendation is to have a greater balance there, and while we want uniform policy, we need greater autonomy of decision-making at the local level. This is going to be about training. It's about having stakeholders engaged in discussions to achieve that balance. The fifth recommendation is to improve the DCFS and Administrative Office of the Courts working relationship. Part of it is agreeing upon what's the right performance goals, what's the right data management, how do you measure statistically what we're doing with our children, and are we accomplishing it in the right way. In order to have everyone on the same page, you've got to have a uniform agreement of what is our objectives and how do we measure the performance and the success toward those objectives. This is going to be another objective that we will have to accomplish simply by working together, by interagency cooperation. The sixth recommendation is expedite the filling of DCFS vacancies. Caseworkers, additional employees, we have already addressed that by lifting our hiring freeze, by streamlining the approval process for new positions as they are available. Seventhly, the recommendation is to develop DCFS principles of practice to provide better guides for field services. This is like a model, principles of practice. The best practices are out there from start to finish that can be a guide for our caseworkers in the field to know what the model is, how they can learn from that, how they can put that into practice and balance that with using their own judgment skills, discretion, local environment to determine what flexibility is needed in a particular circumstance. The eighth recommendation is additional training of our DCFS staff directed at protection planning. And this is where poor caregiving activities that result in neglect or harm. How do you remedy that? How do you train our caseworkers to know how to deal with those circumstances where you're taking them out and putting them in protective services because of maltreatment, bad practices in homes? How do you remedy that, and how do you train them to do that? The eighth recommendation is additional training. The ninth recommendation is to expand the availability of mental health services. And so as a child in need of protective services is taken out of a home, mental health counseling, mental health services many times are needed in those circumstances. It's a resource challenge. It is availability of mental health resources and coordination of those resources with the need. This is a challenge that's going to cost some money. I don't have a figure for exactly what that will be. We have Representative Meeks, we have other members of the legislature here that we need to partner with them to make sure that we can look at this from a resource standpoint as exactly what is needed and what the solution is. The 10th recommendation is a 3-year plan is recommended to reduce the caseloads of our field workers when it comes to protective services. Nationally, I believe the model is 15 per caseworker, 15 cases per caseworker. Right now in Arkansas, under the report, we have 29 cases per caseworker. That is a strain on the caseworker. It leads to increased turnover. It leads to bad morale and bad decisions and bad performance. And so our objective is to reduce the caseload for those caseworkers in the field. I want to applaud Paul Vincent for being from the South and understanding limited resources, and he suggested a reasonable goal is to accomplish this reduction over 3 years and to have a goal to reduce the caseload from 29 to 20. I've asked DHS to put a cost figure on that, and the preliminary numbers is that this would cost us, from the state dollars, about $8 million. As governor, I'm committed to make sure we find room for that in the budget and to meet the objectives of that 3-year plan. We also need to have, it's a good recommendation that whenever new legislation is considered that impacts DHS policy in regards to children, we need to have a fiscal impact statement as to what that means in terms of paperwork strain, workload responsibilities on our caseworkers. And so the recommendation is a fiscal impact statement on new legislation that impacts workloads for our caseworkers. I hope that the legislature will be responsive to that as well. And finally, the recommendation is to emphasize the joint responsibility for implementation of these recommendations, not just with the governor's office, but with the legislative branch and even with the administrative office of the courts. It's a joint responsibility. Again, I'm asking Ms. Gooman to lead the direction from the governor's office, but also to enlist our legislative leaders in addressing this. As governor, I'm accepting these recommendations, and I'm asking the legislature, I know that they will be responsive as well. And so let me just end by saying this has been an important milestone for the protection of our children in Arkansas. I'm committed to make sure that we're in this for the long haul, that we address these challenges, we reduce the caseload, and that we do this in partnership with the faith-based organizations that will be brought together at the Governor's Summit that will be coming up in August. Many challenges here, but many opportunities to do something really much better for the children of Arkansas, and that's something I think that all of Arkansas will support. With that, I wanted to ask Director Selig if he had any follow-up comment, and also Mr. Vincent. Paul, why don't you come up here? Do you have a, and you can tell him whether I misrepresented your report or not. Thank you for your work, Paul.
Thank you.
John, why don't you come up here?
Well, I think you're very fortunate that the governor is such a quick study, because if I had been asked to give you a broad overview of the report, you probably would have been here an hour while I tried to pull a central theme out of the details. So I can't quibble with you, Governor. That's a pretty accurate description of what I experienced. And I do want to echo one thing the governor said to start with. We do a lot of evaluation work as well as work in helping systems improve their practice. Some small percentage of that work has been in federal court monitoring roles, but much of it is in states that are struggling to improve themselves outside of the courtroom. And I don't believe I've ever experienced a more open and receptive welcome to all of my efforts to find out how the system was working. DHS, DCFS, the AOC staff, other state agencies, the provider community, and your faith-based partners and other advocates and providers didn't hold back, provided me with anything and everything I asked for. And I think out of the challenges that always are the focus of an evaluation like this, I think a strength you can hang on to is that everyone I talk to is eager to see the department improve its performance. And many of them also recognize that the department is doing some things well, and certainly in the face of the resource challenges the department faces. But I think equally important to a person, everybody wants to help. And I think that's one reason that theme is so strong in this report, is that child welfare systems, I can say, having been the director of one and been a defendant in a class action lawsuit when I was Alabama's director in the 90s, there's a tendency when you're under this kind of pressure and you don't lack for critics to sort of circle the wagons and try to figure out all of the solutions yourself. And I've been in those shoes, and where I've seen systems been successful, and that's certainly been my experience, it's when you invited your partners in to help solve the problem. And I think you have a state that's responsive to children's interest here, and I think that's a real asset, that you can turn to your partners as allies in designing the improvements that the governor's described to you. I won't go any more into the details. I'll let John speak, and I'll turn over the moderation to someone else.
I'll take the moderation, but John.
I'll just make a couple of comments. I just would remind people, we serve a lot of people in Department of Human Services, but there are only a few of them who are actually in our custody. They are our kids, the state of Arkansas's kids, so we have a particular responsibility to serve these children well. And I want to thank Mr. Vince. I thought it was a very balanced report. It gives us a great roadmap. And one thing I've learned about you, Governor, is when you think something makes sense, you don't hesitate to make a decision. So we in DHS really appreciate, and I know our caseworkers in DCFS will appreciate the fact that you're making a commitment to really see this through and give them some relief. So, because they clearly want to do the right thing, I think having some additional resources and making the policy changes and working together better, working with Ms. Gooman is really going to help. So thank you.
Thanks, John. I wanted the legislators in the room would just introduce yourself. Usually they lurk in the shadows back there, so I like to identify always where they are. No, thank you very much for your leadership on this, your interest in being here today. With that, I'll turn it over for questions.
The $80 million figure, can you elaborate on that? Is that annually or total of that 3-year period? Is that the amount they're going to be seeking from the legislature?
First of all, that was about a 12-hour quick tabulation of that amount. And so we'll work and adjust it as needed, but I think that's fairly accurate. And that is the amount of the state application. So there is some federal dollars that will help us in that to meet that objective. But that $8 million will be the final number when you get to the end of the 3 years. And so the first year will be, a graduated, it'll be a smaller amount to make the first installment on reducing the caseload, recruiting more workers. The second year will go up some more, and then the third year, whenever we finish that project, then it'll be at the $8 million commitment. And so we'll gradually build up to that $8 million.
Governor, was there any challenge that specifically surprised you that came out of this report, or something that you didn't personally know about?
Yes. Statistics are one thing, but whenever you talk about the impact and the challenge on the caseworkers and on the children impacted, that's what impacted me. Whenever you hear about a caseworker taking a child into custody and not being able to find a home for them, and they have to be faced with a choice of bringing them to their own home, bringing them to an office, being on the call to different foster parents saying, can you take one more? That is a heart-rendering judgment on our inadequacy. And so that touched me. That made me realize from a very real standpoint the challenge that we face and the urgency of this need.
You mentioned changes to relative caregiver policies, because the report seemed to highlight that there was an underuse maybe of relative placements.
Yes.
Can you speak to that a little bit more?
Arkansas has a lower rate of relative placement than the national average and our surrounding states. And you would think that logically looking at relative placement would be the first place to look. And I do think this is a reflection of probably the wrong priority at DHS. We've emphasized the wrong way, or we've got some problem there, but it's also the administrative office of the courts. This is the judges that are making these decisions. And so I think this is a change in emphasis, a change in policy, and I think there's been some hurdles that Paul mentions in his report that we need to address. And so this was a very instructive statistic and something that we can change that doesn't cost money, but it's a change in policy.
Of the 11 recommendations, which one is the highest priority that you want to address immediately?
Well, I think the highest priority is the increased number of placement homes so that we can relieve that strain on both the caseworkers and have a home for the child. And this is one that money doesn't solve. It takes willing volunteers to say, we will take a child in foster care. It takes organizations and individuals. So that's, to me, the most urgent need. The second urgent need would be to gradually increase our staff capability to respond to emergency circumstances and placement.
Governor, one of the more disturbing statistics in the report was that there were 23 fatalities of children and families under the DCFS in 2011, and there have been 40 so far this year. It says there's no causal relationship, but so how do we address that statistic, and why is it going down?
You know, that's one, you worded that question very fairly, and I appreciate that. And the question addresses the most serious concern, and that is the increased number of fatalities of some who have had contact with DHS. But again, I appreciate the fairness of the report, that it was not any causal impact, or wasn't any pointed thing that something was done wrong. I think it's reflective of the challenge that we have in Arkansas in terms of proper care, education, as well as a quick response. But that's something I don't have an answer to. It's a challenge that was raised that we've got to work at from an interagency standpoint to address.
The report says that Arkansas has a higher rate than the national average of child maltreatment, and it's higher for the region too. Do you think there also need to be some more long-term approaches to that problem?
You know, that stuck out to me as well, but I think you're right on child was it maltreatment or? Yeah, because there's also a higher rate of reporting and significantly higher. Is that on the maltreatment, or was another word for it? I thought it was hunger or something.
But the reporting is much higher.
But it's on maltreatment, so there's the right terminology for it. Yes, so the reporting is much higher, and I asked the question of Paul, does this mean we're just doing a better job of people are concerned and responsive, because our reporting of maltreatment to the hotline is significantly higher than our surrounding states. And perhaps it reflects the fact that Arkansas does care. But then also we do have a high rate of maltreatment, and that's got to be addressed. You know, DHS can respond. We can provide some additional services to eliminate the challenge or to reduce it, but ultimately this is a much bigger problem than simply what government can do. This is a growing economy. It is about education. It is about the strength of the family, the responsibility of parents and children. These are things that we've got to address very comprehensively as a state, and the burden does not completely fall on government, but we've got to look more closely at that.
Do you have any preliminary sense or range of what the total cost would be, in addition to $8 million for the caseworkers?
On the mental health side, the answer is no, I don't. I think the 8 million figure is probably the high number that we're going to be dealing with here, but there's going to have to be an additional amount for mental health services. I think it'll be smaller than that. We just don't know what that will be.
How many more caseworkers will the 8 million ultimately end up hiring?
Do we have the number on that? I guess I'm sure we do. What is it?
A little over 200.
200 additional caseworkers?
Plus staff altogether. There's some supervisors in there, but.
Right. That's a,
Is that what we're requesting on as soon as next year's fiscal session?
no. This is a 3-year plan, and the specifics of that 3-year plan has not been addressed. For example, we'll have to work with DHS to say how long will it take to increase the hiring pool, to do the training, to bring on our first phase of it. Our first phase might be 45 the first year, and increase that the second year. So that's something that has to be worked out carefully, but We wouldn't commit to a specific number or amount the first year. We just want to see what's doable and what's reasonable to increase the workers.
I'm sure there's information that you've received that isn't in this report and conversations that you might have had with Mr. Vincent. Given the things that the state is doing right and also the challenges that DCFS still has before it, are you confident that children that are placed in DCFS's care are better off than the homes they're leaving? What's your impression of the quality of care that they're getting through this system?
Well, first of all, I have confidence that we've got to make the right judgment that a child should not be taken out of a home unless they're going to be better off and they need to be moved for their own protection and well-being. So that's a fundamental criteria and judgment call that has to be made. And so yes, they're under those circumstances better off in the custody of DHS. Even though it might not be the most ideal circumstances, it was a necessary placement. We've just got to make sure that when they are in the, as John Selig pointed out, the control, the custody of the state, that we do our responsibility and do it well for the children. We want it to be the right experience for them, and it gives them a legitimate second chance, and to give them the support that they need, whether that's reunification with the family or whether that is permanent placement in foster care and then adoption. We've got to have support to accomplish the responsibility of the state. All right, one more question. I wore you out. Listen, thank everyone for your work on this and for what we will do in the future. Thank you very much.